Namaste. I am Dr. Nagaprabha. I am dietitian working for Chandray Rheumatology and Immunology and Research Center. As part of Gout Awareness Day celebration, I would wish to talk on the topic gout and diet, managing triggers for flare-ups, meal planning for gout, balancing flavor and health. As we know, there are different types of arthritis like rheumatoid arthritis, osteoarthritis, uh, fibromyalgia, SLE, lupus, ankylosing spondylitis. Like that, different types of arthritis are there. Up to my observation, ankylosing spondylitis is observed more in patients who are doing seated jobs, like in IT/BT companies, working hours together in front of system computer. So like that, they are facing this type of arthritis, while osteoarthritis is more common in women after the age of 40, and also overweight people, obese men are also facing this osteoarthritis. And this gout arthritis is one of the type of arthritis. It is a common and complex form of arthritis. It may affect anyone. It is characterized by sudden severe attacks of pain, swelling, redness in that part of the organ, and also it is very difficult for the person to move. Are some of the signs and symptoms of arthritis. Like here, the fingers have swelling, redness, pain, and here a youngster facing lot of problems. He's slightly overweight. He is obese. So obesity is also one of the factor. He's having elbows pain, shoulder pain, all joints pain. So here the palms, the redness, the swelling in the thumb portion, swelling in the thumb foot portion. So here the person is facing lot of pain, swelling in his foot portion, thumb portion also, redness, and it is very difficult to walk also in this condition of gout arthritis. So in this way, arthritis has severe joint pains in the knee part, in the foot part, in the elbow part, in the shoulder part. So the joints do have severe pain, and this youngster is facing lot of pain in his knee, and it is difficult to move. And the elderly is facing elbows pain, joints pain in his hands, arms. So this is due to gout arthritis. Even children do suffer from this if they are not having proper, good, healthy diet. So this thumb portion swelling, redness, inflammation is found, and it is swelling is there in the thumb portion, and blood clot is forms this redness, and severe pain is very much severe that the person cannot walk in this condition. Prevalence of gout arthritis in India is around 0.5%. So here India is becoming more the topmost in the disease called diabetes, and also many diseases are there like hypertension, hypothyroid. People are taking medications for them. So they are long-term medications, lifelong they have to take some medications. So the intake of these medicines also is one of the reason for uric acid accumulation in the system, and thus lead to gout. And also children and youngsters do have high calorie foods like pizza, burger, all are Western foods. People are attracted towards our Western lifestyle, Western foods, and this has led to this increase in gout arthritis. It may increase more than 0.5% if it is ignored, and proper care if proper care is not taken. So diet management plays a major role in managing gout arthritis. Purine-rich foods must be avoided in this condition. All are non-vegetarian foods, especially seafoods like different types of fishes, sea fishes like shellfish, shrimp, lobster, sardines, etc. Sure, they have purines which break down into uric acid in our system, and when this uric acid gets accumulated in the joints, leads to severe pain, swelling, inflammation. So such foods must be avoided. And also green leafy vegetables are very much necessary for us. But in this condition, that is in gout arthritis, we need to avoid palak leaves based recipes like palak paneer, palak sabji, palak sambar. So that must be avoided as palak leaves do contain more proportion of purines. And also asparagus. Asparagus is a Ayurvedic herb used for diabetes treatment, diabetes mellitus treatment. We don't use it for, as such for our meals. It is used as an herbal treatment, Ayurvedic treatment. So that must be avoided. And also in case of seafoods, all varieties of fishes must be avoided. In case of non-vegetarian, other non-vegetarian foods, red meat, lamb, pork, all these must be avoided as they contain more proteins as well as more purines in them, which may break down and result in uric acid formation in our joints and lead to gout arthritis. And also, as I told before, we are moving towards Western lifestyle. So alcohol intake has become more common both in men and women, especially in IB, those who work in ITBT centers. So people, especially during weekends, they due to happiness also, they do get together with friends and they will consume alcohol, and they may not be aware about the portion they have taken. They may have that mind that they have only taken limited quantity, but due to that happiness, that while speaking to their friends and all, the quantity of alcohol intake may be increased. And also due to stress, due to personal problems, health issues, and also tensions, worries, the people do intake alcohol to relieve that stress, to relieve their mental stress due to depression, mental depression. So personal problems also, they do consume alcohol. Due to that sadness, that alcohol quantity intake may be more. But in front of us, when they come to us, they tell, no, they do take limited quantity, weekly once or twice like that. But due to that worries and all, the quantity, they are not aware about the quantity they have taken. Either in happiness mood or in the sad mood, they do consume more alcohol. And also, these soft drinks are flavored sweetened beverages, soft drinks. So our youngsters are more attracted towards these flavored sweetened soft drinks. They are just flavored with orange juice, flavored with lemon juice, but they are not really lemon juice or orange juice. So all these Pepsi, Coca-Cola, Sprite, 7-Up, they are carbonated beverages. They have a sweetener, sugar units in them. This sugar in it increases the inflammation in our system and thus lead to gout arthritis. So such soft drinks must be avoided in case of gout arthritis. So I would wish to conclude that we need to avoid Western lifestyle, Western food culture. We need to have healthy food culture, healthy food style, like having more fluids in our system. Around 3 to 3.5 liters of water intake must be taken, water as such, and also in the form of fluids like vegetable soups, rava ganji, ragi ganji, oats ganji, homemade fresh fruit juices with limited sugar in them, and also cucumber salad. We can use them when we are working in front of a computer. Every 3 hours, we can have them, either cucumber salads, cucumber slices, because cucumber has 99% of water. So we are rehydrating ourselves. So uric acid can be released through urine. So that way, we can overcome this problem. And also other healthy drinks like buttermilk, tender coconut water, water as such, all vegetable soups, homemade vegetable soups are all very good to rehydrate ourselves and also avoid disease disorders like gout arthritis. And also, as I told, I informed before, we need to avoid non-vegetarian foods, alcoholic, sweetened, carbonated beverages, that is Pepsi, Coca-Cola, Sprite, 7-Up and all, and palak leaf-based cuisines like palak paneer, palak sabji, palak curry, when the person is facing this gout arthritis. We need to have balanced diet with fresh fruits, vegetables, whole grains, millets, dairy products like buttermilk, pulses. Pulses must be taken as dal curry, dal sambar, sprouts. But since pulses do have proteins in them, we need to have portion size, limited portion size when in the case of gout arthritis, as the proteins do have, when they are metabolized, the uric acid is being released. If it gets collected in the joints, it really results in gout arthritis. So with this, I would wish to inform that we need to hydrate ourselves by taking more healthy beverages, more fluid intake, avoid non-vegetarian foods, avoid alcohol in this gout arthritis condition, avoid palak leaf-based cuisines, have other vegetables, fruits, whole grains, and thus overcome this gout arthritis problem, and also taking proper medications advised by the rheumatologist also helps to overcome this gout arthritis health issues. And also we need to follow the exercises informed by the physiotherapist during this condition, and also doing all these exercises as per the advice of the physiotherapist. The gout arthritis issue can be inflammation, swelling, redness can be relieved, the pain will be relieved, and thus we can overcome gout arthritis. Thank you for watching this session. Thank you.